If you've suffered a meniscus tear and you want to try to avoid surgery, we're going to show you some exercises to at least try to get better on your own. I'm Dr. David Gege, orthopedic surgeon and sports medicine specialist, with my friend and physical therapist, Yves Gege. Meniscus tears are the most common surgery in all of orthopedic surgery, not just sports medicine. That's that C-shaped shock absorber that you have on either side of your knee, and a lot of times it hurts so much that you can't do your sport or your exercise and you ultimately have surgery. But a lot of people have meniscus tears that we call degenerative, where it comes on with some early wear and tear like arthritis. And in that case, you might not need surgery. So what I'd like to do with Yves here is talk about a few exercises that can help with your motion and strength and hopefully maybe get you back on the road to recovery without coming to see somebody like me to have surgery. So let's talk about some ways that you might get better.
Yeah. So yeah, these are very painful injuries, right?
Yeah.
You do not want to move that knee. Walking can be difficult. So what we've noticed is when people get the best outcomes is when they get motion back early, right? So that's the first exercise that we're going to work on.
Okay.
So, I mean, it's really, really simple. You can do it at home. You don't need much. You literally, all you need is a floor.
Okay.
So I'll show you first and I'll let you try it. So we're going to get on your knees. And the key here is literally just to rock back until you start to feel a stretch or maybe a little bit of discomfort in knees, and you're going to go as far back as you can.
Okay, let me try that.
Shot.
And so just sort of gently push back.
Right. And usually the injured side is going to not want to go as far as the other side, right? So let that pain, that stiffness, whatever it may be, dictate how far you go back.
Yeah, typically with a meniscus tear, the tear is in what we call the posterior horn. It's in the back of the meniscus. So it's going to hurt in the back of your knee when you do that. So do you go past where it starts to hurt, or do you stop when you start to feel that discomfort?
Right. You would stop right there where you feel that discomfort.
Okay.
Hold it there anywhere from 20 to 30 seconds. Really probably not much more for this exercise, as there's going to be some stiffness. And I would say do 2 to 3 sets on that side to start, again, getting some motion back, getting that knee feeling better.
Okay, terrific. And I can see that you do that every time. You might get a few more degrees range of motion. Terrific. All right, so how can we get our strength back after dealing with one of these injuries?
Yeah, so you're going to get some inflammation, you're going to get some swelling, and a lot of times, as you know, those muscles don't want to get active. So we're going to start waking them back up again. And it's one of my personal favorite exercises. It's the squat. So the first thing we're going to do is very simple. You're going to put your feet shoulder length apart. The thing that you want to focus on here is sending your hips backwards as you start to bend your knees. You're going to let your knees dictate how far down you go, and you're going to try to push back up.
And how deep should we take this down?
I would say let your knees dictate it. You're typically going to go to parallel and not much lower.
Okay.
Because the thing that you want to focus on here is not necessarily your depths. What you're going to focus on, this is what we do with a lot of our patients, is focusing on keeping equal weight between your right and left leg. You're going to notice, if you'll do this in a mirror, you'll see you'll start to shy away from that side.
Yeah, that makes sense. If this is the one that hurts, you're probably going to try to put all your weight over here. That makes sense.
Get that strength back to their side by really focusing on keeping equal weight between both feet. Again, 10 to 15 reps, 2 to 3 sets on each side. If it starts to get more sore, starts to get more painful, decrease the range of motion or possibly decrease the reps and sets.
And how slowly, how quickly, I mean, do we want, like you see people in the gym, fairly quick squats. We don't want that here. We want more controlled motions.
100%. You want that slow, controlled motion, again, so you can focus on where the weight's going and how it's feeling. You don't want to suddenly drop down low and risk possibly making the pain worse.
So if you've suffered an injury that you think might be a meniscus tear, try these out and see how they go. Now, with a lot of meniscus tears, they don't heal on their own. So you may still have trouble with this and still may not be able to get back to what you want to do. So I think Yves would agree, if you're not making a lot of progress, maybe see a physical therapist, definitely consider seeing a doctor. But hopefully this was helpful. If you want more information and more videos on meniscus tears, click the link below. You'll also find links to Yves' social media and get all kinds of terrific physical therapy information. Make sure you subscribe, and we look forward to seeing you next time.